I am William Gerald Teague, a pediatric pulmonologist. I practice at UVA Health Children. So my research is involved with wheeze and viral infections, and we're trying to understand how the two are connected. What we've done is discover a new problem where children with wheeze have viral infections that they don't even know they have, but it's contributing to the wheeze. Many of these children, the actual steroids they take are making their problem worse. And the other thing we've learned is that stopping the steroids and replacing it with specific antiviral treatments has made a big difference. When we understand the role of viruses in their wheeze, we can replace the steroid treatment with a more specific treatment called azithromycin, which most people think is an antibiotic, which does work in that way, but it also has anti-inflammatory properties, and it supports the immune response to viruses, which of course is how it works. I see the research having a large impact. We're getting towards what's called precise therapy, targeted therapy. As we look at each child with wheeze, we try and understand the mechanism, the driver, and then we arrange the treatment specific for that child instead of just general treatment. The next step for us is to see if this syndrome, this issue we've described, virus-triggered wheeze, leads to persistent asthma. In other words, does asthma, which starts later in life, is it preceded in younger children with these virus-triggered episodes? And we're trying to understand that link and how it affects the lung.